Hello there, how are you? My name is Theodore. I'm going to be your student nurse for the evening. I'm coming in because we had some orders for the doctor in place. To put a Foley catheter in. Uh, yeah, could you just before I was going to explain it to you, could you identify yourself? Okay, thank you very much. Yeah, so what the Foley catheter generally is so while I'm talking to him, I'm going to wash my hands. I'm going to give us some privacy. Foley catheters help you release that you're noticing that you're retaining a little bit of fluids, urine. So the doctor put an order for a Foley catheter to put in so we can release some of that urine. Okay, it's not a very long procedure. It might be a little uncomfortable, but we're trying to make it as comfortable as possible and as quick as possible. Okay, so I'm just gonna go ahead and get started there real quick. And then before I get started, let me ask you: do you have any allergies towards betadine or latex? No, you don't? Okay, great. That'll work. Right, so as I get started, I'm gonna pull this back right here and just expose you a little bit. I'm gonna fix your knees in a bent form. All right, and you can just keep still right there for me. And then first I would also check to make sure that she was clean, and if not, I would clean the perineal area to make sure she was clean down there. Some of these wipes that we have here. We're going to get this started. I'm getting the drape, maintaining my 1-inch sterile field. I would be donning this drape if it was for a male. Drape over them. We're not, so we're putting that to the side. All right, I will start. Get my betadine. Squirt my betadine into my solution. But initially I would not reach my hand over because that would be breaking the sterile field. So I would bring it around and drop that down. get my lube. I push my lube down into here. I'm going to connect. Hold this so it doesn't flap all over the place. Push it into my lube. Okay, and now I'm ready to move it from the table down in between the patient's legs. I'm going to take the sterile field. In between the patient's legs. Okay, so as I get started, I'm going to tell the patient, I'm going to clean the patient with my non-dominant hand. I'm going to hold the vagina and open the labia. If it was a male doing the cleaning, I would hold the tip of the penis, wipe around starting from the middle, circular motions around. For the female, I'll take the betadine, wipe furthest away, dispose of. I'm holding a labia. Wipe towards me, on the closer side, and then straight down the middle. With the Foley as I'm holding. So the person's going to be a little hard, it's going to be a little uncomfortable. So I have to bear down as I'm pushing in, get open up the lube, and begin to insert. So I insert 1 to 2 inches, I get flash, urine flash, I push in 1 to 2 more inches. Okay, there it is right there. Then I hold it. Other hand to inflate the balloon. Then I separate it. All this in now. I would take the stat lock and secure it to the leg. Then I would take off my gloves, make sure they're secure to the leg, take the bag, hang the bag on the side of the bed, on a non-movable part of the bed. Explain to the patient, I did explain to them to bear down, I adjusted it to the leg. Then I would change my gloves, clean the area, and get rid of everything needed and necessary. Then if I was going to remove it now, I would come explain the procedure to the patient, identify, pull this back, let them know it's going to be quick, easy procedure. I would take the syringe, connect it back. Something to bear down a little bit, and we pull it right on out. Alright, how does that feel? That's okay? Alright. I'm gonna get you cleaned up, take the stat lock off of the leg. Make sure that they're clean. And wipe her down.